upload a copy of the PowerPoint presentation through your chat box. And we also have some other handouts that we will upload through the chat box as well. I would like to introduce to you your first speaker for this afternoon, Crystal Pope. Crystal.
Hi, Valencia. And it's actually Kate who's going to start us off, I think, and then we'll get to some of the content.
Great. Thanks, everybody. Hi, my name is Kate Briddell. I'm the HIV Housing and Health Program Manager here at Collaborative Solutions, and we are pleased to welcome you to this HOPWA COVID-19 updates for HOPWA grantees and project sponsors Q&A webinar. Today's speakers are, as you heard, myself, Kate Briddell, and Crystal Pope from Collaborative Solutions. Also on the line are staff from the Office of HIV/AIDS Housing at HUD, Ben Ayers, the Deputy Director, and Amy Palalonis, the Senior Program Specialist. Monitoring the chat box are Emily Fishbein and Christine Campbell from Collaborative Solutions. Today's webinar objectives are to review HOPWA COVID-19 in guidance and information sources, provide updated information on COVID-19 activities and cost eligibility across the different HOPWA funding streams, including the CARES Act, the FY20 funds designated for COVID-19, and the regular HOPWA allocations. We also want to introduce information about STRMU operations, short-term rent, mortgage, and utility assistance operations when utilizing multiple HOPWA funding streams, provide Q&A review on key topics, identify where webinar participants can go for additional information and assistance, and answer questions. We want to encourage you to put questions in the chat box, particularly about the STRMU, because we really want to hear what your questions are related to those things. As usual, we have a lot of material to cover, so we may not be able to answer all of your questions during today's webinar, but putting your things into the chat box helps us know what kind of questions that you have and what you might be struggling with. Some reminders. Remember that waivers and program guidance issued for other programs such as COC and ESG in most cases do not apply to HOPWA. So make sure that you're looking at the appropriate guidance documents. And as communities are deciding how to respond to the specific COVID-related needs of the people living with HIV and AIDS in their community, it's important for HOPWA grantees and project sponsors to work closely together to develop a community response plan. Grantees are responsible for waiver notifications and the development of new procedures, so project sponsors are reminded to follow the plans outlined by their grantees. Another reminder is guidance related to funding and implementation of COVID-19 activities are evolving. New information and requirements are emerging routinely. HOPWA grantees and project sponsors are asked to stay tuned on the HOPWA listserv and the HOPWA guidance page for COVID-19 page on the HUD Exchange and on HUD.gov. And with that, I am going to turn it over to Crystal.
Great, thank you, Kate. Some of what we're talking about today is going to be a repeat from some earlier webinars, and some things will be new. So we're just going to dive right into that. With the multiple memos and waivers that have rolled out over the last few months, it's been very difficult for some folks to keep up with the changes, us too. So we wanted to review the major sources of guidance, especially since grantees are now starting to receive and distribute funds. So this chart may help clarify that information that has been distributed and can also help you locate the full text of waivers and notices that will impact your program when you need it. To date, there have been 2 Mega-Waivers containing HOPWA provisions that have been published, along with a notice about HOPWA-related CARES Act provisions. There have been additional memos related to reporting, IDIS setup, the eviction moratorium, and other topics, all of which can be found on HUD.gov and on the HUD Exchange. But the three shown here on this slide have been the source of the majority of program guidance changes for HOPWA related to COVID-19. The first Mega-Waiver published on April 1st provided the HOPWA waivers shown here. By now, most programs have likely notified their field offices about their intent to use these program waivers. HOPWA Notice CPD 2005 was published on May 8th and provides some detailed information for HOPWA grantees and sponsors on the provision of the CARES Act and how they should be implemented. There was then a second Mega-Waiver released on 5/22 that added we'll go over them, the three additional HOPWA program waivers. Each of these documents is listed on the resource slide at the end of the presentation and is also available on the HOPWA COVID-19 page on the HUD Exchange. We really recommend that grantees keep these on hand for reference. In addition, HUD's Office of HIV/AIDS Housing has released and continues to release really information on certain HOPWA program flexibilities that are allowed, but that are not based on regulatory requirements. So first, let's look briefly at the two waivers that have been released. Mega-Waiver 1 contains 4 HOPWA-specific waiver provisions, as you can see, and those include self-certification of income and credible information on HIV status. This is a provision that allows grantees and project sponsors to accept self-certification of income in cases where access to source documentation on income is not available or accessible. It also allows the acceptance of client-provided self-attestation about HIV status in cases where that source documentation is also unavailable. The FMR rent standards for TBRA is a provision that allows grantees to increase the rent standard used for TBRA if needed for a year. Property standards for TBRA allows a temporary delay of in-person, on-site initial inspections of TBRA units, as long as remote methods can be put in place to do so. And HOPWA Space and Security is the last one on that waiver and allows flexibility in the type and size of space provided for a person or a household, such as placing a family temporarily in a small hotel unit. And each of these has the link to the waiver that would provide more information about these. Mega-Waiver 2, which was released on May 22nd, contains 3 HOPWA-specific waiver provisions. These include time limits for short-term housing facilities and STRMU, which allows programs to extend the short-term supported housing limits to 120 days versus 60 in a 6-month period, as determined on an individual household basis. Also, this provision allows an increase in STRMU limits on an individual household basis for up to 52 weeks in a 52-week period. It also extended both the property standards and FMR standard waivers for other housing besides TBRA. So it also applies to other rental housing, such as that's done for master leasing. So remember that to utilize any or all of these waiver provisions, grantees have to notify their field office of their intent. Also, please make sure you read the full waivers so that you know the limitations and the details, as well as the requirements for policies and procedures and documentation that go along with all of this. I mean, we are all having to document the heck out of everything. So you can also download any previous webinar presentations that spoke to these waivers more in depth from the HOPWA COVID-19 resource page that's listed at the end of the presentation. The next guidance resource is the HOPWA Notice CPD 2005. What the notice does is really give a further explanation about the implementation of CARES Act provisions and activities related to HOPWA. So we encourage you to review that carefully as well before you begin program implementation. And the last source of information is a series of HOPWA program flexibilities announced by OHH. These relate to a variety of program functions that are not dictated by the regulations, but they're really intended to help programs more easily meet the needs of clients impacted by COVID-19. These are just a few examples of that kind of flexibility. These have been covered in previous Q&A webinars, so you can access those on the resource page. And there'll also be some brief fact sheets coming out very shortly that will be posted on the HUD Exchange that will tell you about these things in more depth. So as grantees are beginning to receive their CARES Act funds and contract with sponsors for COVID-19 related activities, we're seeing more questions about what's eligible to be funded under CARES and through other awards. Some of this information has evolved, as most of you know, and has changed in the last few months. So we want to do a review here and provide some more information on cost and activity eligibility as it stands right now. Just to review the basic activity eligibility for CARES, this language comes right from the notice and provides an overview of what the CARES Act funds can be used for. The information here about the use of CARES Act funds reminds us that these funds may be used for any, excuse me, any of the eligible HOPWA activities listed in the regulations, as long as it addresses community needs related to preparedness and response to the virus. Also note that the CARES Act funds may be used to reimburse allowable costs incurred for allowable activities prior to the receipt of CARES funding. That can actually be done retroactively back to January 21st, 2020, which was the date of the first confirmed case in the US. These are more specific activities that are called out in the CARES Act, specifically focused on assisting client households with COVID-19 related challenges, such as the need for hotel stays, transportation, essential services, nutrition, education on COVID-19, and infection control measures. All of these activities have been addressed in more depth in prior webinars and fact sheets and can be accessed on HUD.gov and the HUD Exchange. This is, I think, an important reminder for grantees about what was a new funding option that was introduced in the notice. It allows grantees to designate a portion of their FY20 allocations for allowable activities related to COVID-19. Also, as a reminder, in order to do that, grantees must have the activities approved in their FY20 annual action plans, and these funds can only be used when all of the grantees' CARES Act funding has been expended. When designating FY20 funds in this way, I mean, remember that it can really help extend your response to COVID-19. And additionally, all of the designated funds will receive the same benefits and flexibilities that are described in the CARES Act. As an example, any FY20 funds that you designate for this use for STRMU may provide up to 24 months of assistance. So it all falls under the CARES Act rules. This establishes, as I mentioned, the earliest date that an eligible activity may be started and outlines the documentation requirements. This is, I think, a good reminder as grantees are setting up their funds, setting up programs, and working with folks who may already have expended money for this purpose. And this slide breaks out the 3 potential HOPWA funding streams that communities can use for HOPWA or for COVID-19 activities. So for formula grantees, there are 3 potential HOPWA funding streams. And that includes CARES Act funding that's been received, any FY20 funds designated for COVID-19, if you're using that option, and their regular formula HOPWA awards. For competitive grantees, they can utilize their CARES Act award, but can also make use of the available waivers when carrying out HOPWA activities that are outlined in their current grants. So the question is, I know there are a lot of questions, but the question of the moment is, how do we make decisions about where to charge HOPWA activities related to COVID-19? And the real answer to that is it depends. There are some HOPWA activities that can be funded utilizing any stream of HOPWA funding, while others may only be carried out using CARES Act funding and the FY20 set aside or designated funds. There's some activities that require the use of waivers, which includes grantee notification to the area HUD field offices that the waivers will be utilized. So in the next few slides, we're going to review some of the primary HOPWA activities and show what can be covered by each HOPWA funding stream. All this information is also contained in the HOPWA COVID-19 activity and cost eligibility chart, which is available for you to download during the webinar and will also be posted on the HUD Exchange. We've broken out the cost eligibility chart information into 5 slides so we can walk through them with you here. So just to explain that the X's in the chart indicate which funding stream or streams may be used for each type of activity. The 3 funding streams are CARES Act funding, the FY20 funds designated for COVID-19. Remember, those are available if approved in your annual action plan and all CARES Act funds have been spent. And the third is any of your regular HOPWA award funding. All of the activities that you see right here fall under supportive services. So for transportation, 2 specific activities are shown. The first is the use of gas cards or vouchers for client transportation. This can be funded through any of the funding streams. The reason it shows new under regular HOPWA awards is because that flexibility was just clarified by OHH last week. Previously, this was something that could only be funded through CARES Act and FY20, but now it is across the board. But also note the caution about documentation and tracking. which is particularly important when using gift cards of any kind. So the second transportation activity is that reasonable car repairs for client vehicles may be paid for, but that is one that can only be paid for with CARES Act or FY20 funds. For nutrition, there are three activities listed. The first is the use of grocery cards for clients' use in buying food. This one is now available under regular HOPWA funds as well. So it can be paid for through any of the funding streams. Also, you can see that grocery or meal delivery, food banks, and all of those similar kinds of nutrition services can be covered through any of the funding streams. This slide continues with a few more selected supportive services. For the first two, which are infection control for clients, that's PPE, cleaning and disinfecting supplies and so on, and infection control for staff, these can be paid for under all three funding streams. There are a few important notes about this though. When you are using your regular HOPWA allocation funds for infection control supplies, you do have to make sure that you document that HOPWA is the payer of last resort in that case, that these items are not available through other local sources. Also a note about purchasing these supplies for staff. This can be an eligible charge under supportive services when you're buying them for staff who are carrying out case management or other similar supportive services. But these kinds of supplies can also be charged to other HOPWA budget line items, such as TBRA, PHP, or STRMU, when they're needed by staff who are carrying out these functions. So there are a couple of different places they can be charged to. But the main point here is that they can be covered under any of these funding streams. And although we haven't listed them here, basically all other eligible HOPWA supportive services can be funded across the board. This slide moves on to housing assistance and specifically to hotel, motel stays or vouchers, which is something we've talked a lot about. And there was a webinar recently that went into depth about how those would be managed and handled. But we wanted to highlight them here because there's some differences in how they can be funded. So as you can see, vouchers for client quarantine or isolation, that's your qualifying HIV positive client, or for emergency housing for HOPWA eligible families, and for extended hotel stays beyond 60 days in a 6-month period. All of those can be funded, can potentially be funded by any of the funding streams. There are 2 hotel motel cost types that can only be funded using CARES Act or FY20 designated funds. Those include funding hotel stays for a non-HIV family member who needs to be quarantined or isolated away from the rest of the family, as well as the use of funds to pay for potential hotel unit damages. Those 2 things can only be funded under CARES and FY20. So the STRMU section of this chart is just showing the differing STRMU limits based on what's allowed under regular HOPWA, the waiver, and CARES. And we'll talk about that in more detail in just a few minutes. But also shown here is short-term facility stays that extend beyond 60 days and up to 120 days in a 6-month period, which can be covered by any funding stream as long as the required waiver is being utilized. And finally, this shows other HOPWA housing activities, including PHP, master leasing and facility-based housing that is either permanent housing or transitional, which can also be covered across any of the funding streams. The important caution here, and we've talked about this some in the past, is to be very careful about using time-limited CARES Act or FY20 designated funding to expand permanent housing units or resources. For instance, if you're planning to use CARES Act funding to add 50 TBRA slots beyond what you're doing now, that could potentially create some difficulty and possible threat of homelessness for households when this time-limited funding is gone. So we would just have you, keep that in mind as you are setting up your CARES program. So we also want to give you a bit more information about STRMU and about the different funding streams and how they fit together for that activity. Actual operations may feel, I'd say, a little tricky at first because the rules are somewhat different based on the funding source or the use of the waiver. We're going to walk through some of the basics today, and then there'll be a webinar dedicated just to the STRMU program and STRMU program operations on August 19th. Some of the guidance on how STRMU operations should or can work is still in development, but we'll do our best to answer any of the questions you have about it. Those of you who run STRMU programs know that a lot of questions are scenario based, right? They're about a specific client situation that comes up. So we would ask you, as Kate mentioned earlier on, please go ahead and put any questions that you have in the chat box and into the AAQ if you'd like to do it later after this webinar. That will really help us with preparation for the STRMU webinar. And help us address the kinds of questions that you may have, because all of this just feels very complex at times. So in looking further at STRMU, when breaking STRMU out by funding sources and by use of the waiver, there are three basic categories of STRMU. The first is your existing STRMU program, if you have one. I know there are some competitive grantees who are implementing STRMU for the first time, but for that existing program, funded through regular HOPWA allocations, in this program, a client may receive up to 21 weeks of assistance in a 52-week period. Or you may have some local caps in place that allow fewer weeks and so forth. All of the STRMU rules apply related to eligibility, legal residency in the unit, and need for the assistance. The second category is that same existing STRMU program in which you're utilizing the 522 waiver option that can be applied on an individual household basis. Approved households can receive up to 12 months of STRMU assistance when using that waiver. And the third is STRMU that's provided using CARES Act funds or the FY20 funds. Remember that the CARES Act funds has to be expended before you can move into FY20 set-aside funds. And in this CARES Act STRMU program, a client household can receive up to 24 months of STRMU. As if STRMU wasn't hard enough to administer anyway, now we've got three kinds, but we know we can do this. So, so let's try to pull apart the categories and how they work. This shows your regular or existing HOPWA program on the left, and a program's use of the 12-month waiver option on the right. Both of these are funded with your regular HOPWA allocations and follow the same normal STRMU rules and limitations, with one exception. When you utilize the waiver option, You can increase STRMU up to 12 months in a 12-month period as determined on an individual household basis. The normal rules apply for the 21 weeks of assistance in a 52-week period. You would have a policy in place and documentation for determining when a household needs more than the 21 weeks in that 52-week period. And then those households can be approved for up to 12 months of assistance within that same period. We'll talk more about this in the STRMU webinar, but it will be advisable that you approve people for additional increments of time, not for the entire 52 weeks, with periodic reassessment of need and re-upping their assistance as time goes on. We also want to clarify that client households receiving STRMU in this category and your regular STRMU and even using the waiver may be moved over to CARES Act STRMU at any time based on your local assessment of need and your policies. There's no requirement to wait until the household has used 21 weeks or 52 weeks of regular STRMU before you move them to CARES Act STRMU. One of the most common questions people ask is what needs to be done differently when you're delivering COVID-19 related STRMU. In this case, using regular STRMU plus the waiver option. For the most part, your program can actually continue as it has been with a few additional requirements. You have to establish written policies and procedures explaining how extensions are granted on a per household level, and laying out a requirement for regular reassessment of the needs of the households. You must document the good faith efforts that have been made to assist the household within that normal program limit and show that the need is continuing. Also note that the waiver is in place for 1 year, beginning on the date of the waiver of 5/22. The third category of STRMU is funded by CARES Act funds and by that FY20 designated funding. STRMU funded by either of these will operate under CARES Act rules, and households may receive up to 24 months of assistance. This category of STRMU requires the same basic program rules related to eligibility, residency in unit, and need. But beyond that, it's easier if you look at this CARES Act STRMU program as a completely separate program. As noted here, the 52-week eligibility period established for your regular STRMU program has no bearing at all on the up to 24 months STRMU under the CARES Act. So if you identify clients using whatever assessment process is developed locally who need extended STRMU for up to 24 months, you can move them to this program category. It doesn't matter if they've already received STRMU assistance through your regular program. When you move them to CARES Act STRMU, the clock really starts at 0. And you could provide assistance up to that maximum if that's what you determine is needed. So, and looking forward to the future, when the CARES Act program and money ends, a client household who received that extended STRMU could potentially move back to your regular HOPWA STRMU program without a wait period. And we'll cover more of that in the STRMU webinar. But your reference on the 12-month eligibility period would go back to the timing of any regular STRMU the client had received in the past. Asking the same question as earlier, what needs to be done differently when delivering STRMU through CARES Act and FY20 funds? So basically, STRMU funded with CARES and FY20 funds will follow all of the normal STRMU rules. but it's specifically not tied to the eligibility periods or time limits for your regular STORMU program. You must also develop written policies and procedures that help determine the process for selecting clients, how the need should be demonstrated, and establish a requirement to regularly reassess the needs of assisted households. Just like we talked about with the waiver, you should document those good faith efforts made to assist the household in shorter periods of times, the reason why additional assistance is needed, and also assure that those FY20 designated funds are not used until available CARES Act funds are depleted. And at this point, I am going to shift over to Kate. Is that right? Let me.
Yes, you are, if I can get myself off mute.
Oh, good. Okay.
So thank you so much, Crystal. That was really informative, and I look forward to this STORMU webinar in August. So here we're going to cover some of the key questions and answers that HOPWA grantees and project sponsors have had. The topics we're going to cover are going to be, very briefly, remote methods and practices, the self-certification of income and HIV waiver, the FMR Standards waiver, inspection requirements, support services, including transportation and car repair, food, nutrition guidance, and cell phones, and that's it. The remote methods and practices question, what types of communication are important to the success of our program while we're trying to adapt to social distancing and community shutdowns? As you know, communications with clients and landlords really should continue to be a priority. So you need to let them know what you're doing and why you're doing it. Letters, emails, website messages, and direct phone calls will help provide information, transparency, and less uncertainty for all of those involved. With your clients, you should provide information on COVID-19 and how they can stay safe. Explain why and how you're changing the way you interact with them and how the program is going to work during this time. Make sure your clients know how to reach your program and how you will be reaching them. Let them know what additional services are available to help, if that's appropriate, and ensure that potential clients know where and how to reach your agency and apply for assistance. Regarding communication with landlords, you should also make sure that you're communicating with them about how your program procedures might be changing during the pandemic. Explain why and how you're changing how you interact with them and how the program is going to work. Explain how remote housing inspections will work and how some inspections may be delayed. And provide a brief fact sheet on remote inspections, especially for new landlords, if that's appropriate. And make sure that all of the landlords and property managers know how to reach your program. Continuing on remote methods and practices, the question is there guidance on waiving of required signatures for clients that are eligible for HOPWA services? And grantees should look at all reasonable remote methods that will allow critical program activities to continue, including ways to bypass any hard signature requirements that are local. Remote methods to obtain signatures may include signed and scanned documents that are emailed back to the program, or the possible use of electronic signatures. Sometimes our clients don't have access to that, and so when those methods aren't possible, programs may allow a client's verbal agreement to be the signature, as long as that's documented by program staff and placed in the client's file. Be sure to document all these transactions really carefully. Policies on remote methods, including verbal attestation of signatures, should be set by grantees to be followed uniformly by project sponsors. And please note, the requirement for hard or wet signatures are generally local requirements and they're not regulatory. Around self-certification of income and HIV, Can you provide examples of credible information on HIV status? What is acceptable? Well, there are several ways a person could possibly provide you with credible information on HIV status. Some of those would include that during an intake conversation, they know things about HIV meds, or they can talk about their doctor or other doctors in the area, or they're knowledgeable about viral suppression, or they can talk about their own status and their HIV medical history. Or you might have a referral from another HIV-specific agency for that client. Or you might have an acknowledgement from a case manager within your agency who's already worked with that client and knows them to be HIV positive. Another question about the HIV documentation waiver provision. Do we apply to all applicants? Well, in practice, your program should still be able to obtain appropriate source documentation of HIV status for many of your potential clients through testing centers or medical facilities. So those options should still be pursued whenever possible. But when source documentation is not available timely, or you can't get it at all, you can make use of this waiver provision. Make sure you have policies in place for allowing other credible information to be used to document HIV status in lieu of source documentation. Your policies should include information about what other credible information document requirements are gathered at program entry, your required timeline for collecting source documentation after the COVID-related restrictions in your community are lifted. That's within 3 months, and actions to be taken if HIV status cannot be documented via source documentation at that time. And let me be clear, the collecting source documentation after COVID-related restrictions in your community are lifted, that's 3 months after the public health authorities have said that that is an appropriate time. So not just 3 months from today. Some additional notes: if you can obtain appropriate source documentation on HIV status, you should continue to do so, but don't delay approvals if not. And use what self-certification or information people have, but make sure you note in their records that you're making use of the waiver. Another note is that only grantees can indicate to their HUD field office that they are going to be using the waiver, and they need to be communicating back to their project sponsors as to whether or not they have chosen to utilize that waiver. Another question about HIV status is, what are the ramifications for our program if a project sponsor is unable to obtain proper documentation to support that eligibility? So if there are cases where source documentation cannot be obtained within that 3-month period, as it would occur if the client is found out to not be HIV positive, then that client will cease to meet HOPWA program eligibility. And so they should be terminated based on your program procedures and directed to other non-HIV specific program resources. I'd expect such cases to be rare, but programs should nonetheless be prepared to take appropriate actions. Documentation throughout this time period should be placed in client records, stating clearly that the credible information on HIV status was accepted per the waiver. With this documentation in place, grantees and project sponsors providing HOPWA assistance to clients who ultimately are shown to be eligible based on HIV status should not be subject to payback requirements. Now on to income. Does self-certification of income apply only during intake to determine HOPWA program eligibility? And the short answer is no. Self-certification of income in lieu of source documentation applies to any program delivery activities in which you need to document income, like intake or program eligibility, income and rent calculations for tenant-based rental assistance, master leasing, or facility-based housing, or annual and interim reassessments for rental assistance. In practice, programs should continue to collect appropriate source documentation for household income whenever possible. But when such documentation isn't available, the waiver allows self-certification of income in order to expedite delivery of needed services and housing during the COVID-19 pandemic. So about the FMR standards, the waiver, what changes does the FMR standard waiver allow? Well, these waivers allow grantees to assist HOPWA eligible households in units that exceed the current rent standard when needed. HOPWA grantees may establish rent standards by unit size that are reasonable and based upon rents being charged for comparable unassisted units in the area, taking into account the location, the size, the quality, amenities, etc. Grantees are still required to ensure the reasonableness of rent charged for a unit in accordance with the regulations. The April 1st Mega-Waiver allows FMR adjustments for HOPWA tenant-based rental assistance only, and the 522 Mega-Waiver allows for FMR adjustments for all HOPWA rental housing for which a rent standard applies, including master leasing. Each waiver may be used for up to 1 year, beginning on the published dates. Please be reminded that having told your field office that you're going to utilize the waiver for TBRA does not extend to your other rental housing. You will have to make use of that second waiver in order to move forward with those waivers as well. So when the rent standard period waiver ends, must all units immediately be returned to the normal rent standard? And after the answer is at the end of the applicable waiver period, programs must cease applying the higher rent standards to newly leased units and return to using the normal standard. Any units for which leases were signed during the waiver period should be returned to the normal rent standard at the time of the HOPWA eligible households lease renewal. Regarding inspection requirements, what are the current requirements for unit inspections? The initial unit inspections must continue. If you're utilizing the property standards waiver, grantees and project sponsors may delay in-person on-site inspections if they are able to visually inspect the unit using technology like video streaming to ensure that the unit meets HQS before the assistance is provided. And you need to have written policies to physically re-inspect the unit after the special measures are no longer necessary. For more detail on that, you should look to the waiver document, the guidance document. Regarding annual unit re-inspections, those can be postponed. There's no waiver required for that. Grantees and sponsors may continue inspections using remote methods, but it's not required. You have to have policies in place detailing how your delays are approved, when inspections should resume, and how the policy will be consistently implemented. Regarding support services, what types of transportation services are allowed through CARES Act funding? Can we provide gas cards or similar payment methods for client-owned vehicles? Yes, you may provide transportation services for eligible households, including costs for privately owned vehicle transportation when needed to access medical care, supplies, and food, or to commute to places of employment. This assistance can take the form of gas cards or similar prepaid debit cards. Please be reminded that when providing gas station or other cards to clients for gasoline purchases, you should put in place methods to restrict purchases to gas or other similar controls whenever possible. Use careful tracking methods for gas purchases and think through any policies needed for waste fraud to prevent waste fraud and abuse. I know this one's on the minds of a lot of people. Can we assist HOPWA households with car repair costs? And grantees may designate a portion of their CARES Act and or their FY20 formula award portion designated for COVID-19 response to supportive services to include transportation, which in this case it could cover car repairs when deemed necessary. Grantees need to have policies and procedures in place related to the use of HOPWA for this purpose, and documentation regarding the required repair of a personal vehicle to ensure transportation as a response to COVID-19. Alternately, if an assisted household has paid for necessary car repairs and is therefore unable to afford their rent, mortgage, or utilities, STRMU can be considered as a part of the housing stability plan. On to nutrition. What types of nutrition services are allowed under CARES Act funding? Can we provide clients with grocery cards, or what about meal delivery? Well, grantees have a lot of flexibility in the provision of nutrition services for eligible households. Food can be delivered in forms such as food bank, groceries, food boxes, meal or grocery deliveries. You can, methods used to provide needed food and groceries to households may include the use of grocery store cards, food delivered by staff or contracting with food delivery services for meals and groceries, food pickup, grocery store sites for clients, or other similar methods based on resources and local needs. Like the gas cards, when providing grocery store or other cards to clients for food purchases, be sure to put in place methods to restrict purchases to food items or other similar controls whenever possible. Be sure to keep careful track of when you're giving out those cards, and think through what policies you might need to prevent waste, fraud, and abuse. And then on to cell phones and wireless service plans and or phone cards for clients. You can purchase cell phones, wireless service plans, and or phone cards for clients when needed to enable provision of supportive services that are necessary to obtain and retain housing and to ensure client safety and stability. If you do go ahead and buy phones, they have to be owned by the project sponsor, and they may be loaned to the clients, and so they must be returned to the sponsor when the emergency need no longer exists. Again, you should have policies and procedures in place for how to make that happen. So prepaid or disposable phones may be purchased for this purpose and may only be loaned to clients. You can purchase phone cards or minutes for clients who already have a phone when they need to access supportive services necessary to obtain and retain housing and ensure client safety and stability. When phones, phone cards, or phone minutes are purchased for the purposes described above, the costs may be charged to HOPWA supportive services. And please note, it may also be possible for sponsors to purchase phones for TBRA programs charged to the TBRA line that can temporarily be loaned to the recipient or landlord when needed to conduct those visual inspections we just talked about. So we want to make sure that you stay informed, and so all the guidance for the HOPWA grantees and project sponsors related to this disease preparedness and response for COVID-19 will be sent out through the HOPWA mailing list. You can sign up for that if you are not already subscribed. Also, updates on HOPWA guidance for COVID-19 is available on the HUD Exchange and on HUD.gov. And there's a list here of all the resources. As Valencia said, she will be sending these slides out to you all after we're done here today. And just to let you know, there are a number of upcoming webinars. You will be learning more about this as they go out on the listserv. We're going to be having one on remote inspections the first week of August. Then the STRMU webinar that Crystal mentioned earlier on August 19th. We'll have a remote methods webinar on August 26th. And then on September 2nd, we're going to go further in depth on supportive services. So again, you can get your questions answered by submitting your questions to the HOPWA Ask a Question help desk. And for the grantees, you can request technical assistance through the HUD Exchange and ask for that. Now we have a few questions in our time remaining, and I believe Emily is going to take the first one.
Yes, hi. One question we have is, if we utilized the FMR rent standard waiver for our TBRA program under the first Mega-Waiver, do we need to exercise the FMR rent standard waiver under the second Mega-Waiver as well?
Sorry, I was still on mute. I will take that one. This is Ben here from the Office of HOPWA's Housing. So the short answer is no, you don't need to, but it may be a good idea to utilize that second waiver for the rent standard for your TBRE program, so that that rent standard with the higher FMR can be applied. This will basically give you an extra month, right? So until, and then just as a reminder, that FMR can be, that higher FMR rate can be applied up until 1 year after the date of the second Mega-Waiver, and that date is May 22nd, 2021. Also, please remember that the higher rent payment flexibility will only be in effect until the expiration date of the lease. So if the waiver time period ends and the lease hasn't ended yet, then that flexibility continues until the lease ends. And if for whatever reason a lease were to end before the waiver ends, I can't imagine that one would, but if for whatever reason that does happen, then you could lease back up, continue to use the waiver under the new lease. And then at the time those leases run out, you'll of course, those rates have to move back to meet the FMR. And also please make sure that you've notified your field office that you will be utilizing the waivers at least 2 days prior to exercising that option.
Thanks, Ben. We have another question. How should we decide which streaming clients will get extended time limits under the regular HOPWA waiver extension, and which clients will get the CARES Act time limits?
This is Amy. I can take that one. I'm hearing an echo though. So I can make sure they're muted. So there could be a few different ways to structure your STROMU program, since there are essentially 3 different funding streams for STROMU. So the CARES Act funds and the designated FY20 formula funds offer the longest duration of STROMU assistance. So for both of those funding streams, it can be used up to 24 months or 2 years. So you may want to use the CARES Act or the designated FY20 formula funds to serve those clients that you anticipate will need help for the longest period of time. So this could be, for example, because it may be a long time before the clients can return back to work if they've lost their jobs, or if they've experienced health issues or other hardships. So you're really encouraged to create a structure that works best for your community. So please remember that you may begin to serve a client with regular STROMU funds and switch to the CARES Act or designated FY20 funds for the same client if you need to. There's a lot of flexibility there. So the STROMU assistance using the CARES Act or the designated FY20 formula funds, that time limit doesn't count against the time limits of regular STROMU. So again, as we mentioned a few times, we are planning a STROMU specific webinar in August, just because all of this is can be pretty complicated. And so we'll discuss a lot of these considerations for implementing STROMU with the different funding streams. So please make sure you sign up for that webinar when the registration info is sent out in the coming weeks.
Thanks, Amy. Do we have time for another question? Okay. Previously, gas cards and food cards were not eligible uses with HOPWA funds. I'd like to make sure I understand the chart in the webinar correctly. We can now use regular HOPWA funds for these being gas cards and food cards?
Yeah, this has been here. Yes, that is correct. Regular HOPWA funds can now be used to pay for these gas cards and food cards for clients under supportive services. I just want to mention, though, that it is critical that you have your policies and procedures that you're putting in place, explaining the measures you will take to prevent fraud, waste, and abuse. And these policies, the policies should be applied whether you're using CARES Act funds or regular HOPWA funds for these services.
Thank you, Ben.
So,
Christine?
do we have time? We're after time. Do you want to keep going? Kate?
Hi, I imagine we have a lot more questions. Let's just
There's a
take
lot
one
more
question.
questions. One more? Okay.
Let's do one more.
Sure. So this question is, we are experiencing administrative delays due to the pandemic. Are we able to delay the submission of our HOPWA caper?
This is Amy, and I can take that one. So yes, so our HOPWA CARES Act implementation notice stated that any HOPWA grantee with an APR or caper due to HUD within 6 months of the date of the notice may have up to a 90-day extension to submit their reports. So if your organization needs to use that 90-day reporting waiver, just like the other waivers, it's a notification process. So please email your HUD field office representative as well as the Office of HIV/AIDS Housing at hopwa@hud.gov, just to let us know your need for and your intent to use the waiver for submission of your APR caper.
Great. Thank you very much for answering that last question, Amy. Thank you all for the questions, and thank you, Emily and Christine, for answering those questions, asking those questions, and thank everyone else for being here. We really appreciate that you took time out of your day to be with us today. As you saw, there will be additional webinars coming up. Thank you for sticking with us. 4 minutes over, and now we will let you get back to your day. So thanks again for joining us. Stay well, and we look forward to working with you in the future.
Again, a copy of today's webinar presentation will be made available on the HUD Exchange. We ask that you check there, and also we will send you a copy of the PowerPoint presentation directly through your email with the email you register for this event. We do appreciate you for taking time out to visit with us on today's webinar. Have a great afternoon. Bye-bye.